Now, 22 passengers from SQ321 are reported to have suffered spinal cord injuries when the plane hit severe turbulence on Tuesday. Now, they are among around 40 people in hospital in Bangkok. 6 are being treated for skull and brain injuries. Now, to tell us more about the chances for recovery, I'm joined by Dr. Dennis Hay. He is the head and Senior Consultant, Division of Spine Surgery at Alexandra Hospital. He is also the Senior Consultant of the University Spine Centre at the National University Hospital. So, welcome. We've obviously got the right person in for the show. First, Dr. Hay, I see that you've brought in some models. Now, using what you've brought in, can you explain to us exactly what happened when the airplane tossed these people around, actually free falling for some 6,000 feet? So take us through with the model. What would have happened on impact?
I think if you look at the model, this model actually tries to show you where the skull is, which is over here.
Right.
And of course, within the skull is actually the brain.
And that's the spine at the bottom.
That is exactly on top of this model.
Yep.
Following the skull, coming down will be the spine. This is only showing the neck part of the spine. We call it the cervical spine, and within which stays the spinal cord. The spinal cord travels in the spine, and it is protected by the spine, which is actually a channel of bone structures that shields it from stress. So when we talk about this turbulence incident, the free fall can actually cause passengers to actually be flung up all the way up to the ceiling. And the first impact would likely be the skull, or sometimes if in an awkward position, certain parts of the body can actually hit the ceiling. And if the skull does get the impact, it actually transmits the force downwards, causing injuries most of the time at the mobile part of the spine, which is at the neck, resulting in either flexion, which is a forward bending injury, or an extension, which is a backward bending injury. These can cause fractures, they can cause dislocations, and with fractures and dislocations, there can be nerve injuries. And in this case, the spinal cord is involved and causing spinal cord injuries.
It sounds horrific, but you've made it quite clear. What I'm curious about is, will the same impact cause the same level of injury depending on other factors aside from the free fall, like your age, your weight, your height?
Yeah, so the impact is very important. The force that is being transmitted during the impact is very important. So I would assume that most of the passengers would get a great force transmitting through the spine, resulting in different kinds of fractures or dislocations, depending on the position they are in. You did mention about the different ages. I think most of the time, that probably is not the most important thing.
Oh, really?
Yes.
Even if it's a young person versus somebody in their 70s? Or...
There are some idiosyncrasies between a young person and an elderly person. In a young person, we recognize that there is this condition called skiwara, spinal cord injury without obvious radiological abnormalities. So they may not have X-ray features or fractures or dislocations, which I mentioned earlier on, but they do have spinal cord injuries. For elderly passengers, they may have a poorer way of reacting to such incidences, and hence be not able to troubleshoot on time, resulting in injuries that may be preventable.
Yeah, interesting that you mentioned that, because there were some questions to us about the position they were in when the incident happened. Would they or could they have suffered less serious injuries seated versus standing, or it doesn't really matter?
I think it does matter because in a seated position, the force required to throw a person up to the ceiling is going to be very different from standing. It's a lot easier for a person to be thrown up when he's in the standing position. So that is the reason why we always say that when there is no business walking around, it's better off sitting down in the plane. And if you are sitting down for a long time and it's comfortable enough, you can do the lap belt across your lap.
Okay. The treatment, right? Let's look forward. We heard in a story earlier, many of them are still in the hospital undergoing treatment. Our reporter told us that some are even having trouble walking and they're bedridden, at least for now. What is the treatment for such injuries? And, perhaps could some be looking at even permanent damage?
The sad thing about nerve injuries or spinal cord brain injuries is that the potential for nerve recovery sometimes can be quite guarded. Nerve recovery potential is a lot less compared to other tissues in the body, which means that if it is a mild injury, of course, there is still room for improvement. There's still chance for improvement. But if, let's say, if it's a severe injury, a lot of patients suffer permanent deficits. And while early treatment and appropriate treatment can be instituted to help damage control, but it is likely that these patients with severe injury continue to suffer from residual neurological deficits impairing their lives. Yeah.
Okay, in English, what does that mean and how long?
It can be permanent.
Yeah.
Yeah. So for mild injuries, we're talking about weeks to months.
Yeah.
For severe injuries, it will be years or even permanent.
Yeah, so because, the question of whether physiotherapy might be able to help them recover faster, what would your advice be to patients who have undergone such spinal injuries and their caregivers?
Physiotherapy is the mainstay of treatment after the initial management, which may involve a resuscitation or even surgical measures. It is definitely important for patients as well as those undergoing those injuries. I would think that no matter what injury it is, be it mild, moderate, or severe, physiotherapy is the important thing that we must do. It does help the patient recover their function, perhaps not the neurological the ability to move their hands, the ability to feel with their hands or legs, but at least to restore certain part of function, because it actually recruits the muscles, tries to retrain the body to be able to do what they usually do in day-to-day lives. So I think that is extremely important.
Absolutely. And right now it's still early days. As they recover in hospital, there'll be at some point in which they would want to return home. Is it wise to move them at this point, or to their home countries?
I think the key would be to stabilize them.
Yeah.
So apart from spinal cord injury, some of these patients may have injuries to other parts of the body, other organ injuries. So they must be stabilized first. Once they are stabilized and the patient can be safely transported back to their own respective countries, back to Singapore for Singaporeans, then they will be able to do so. Yeah.
And continue the recovery here.
Certainly.
This sounds like a long-term process. Is it expensive as well?
Yes. In fact, I would say that patients with spinal cord injuries, with neurological deficits where they can't do their daily activities of living, they need a lot of support. And this support comes often with burden to their family members, to their close ones. So the economical burden, the social, psychological burden is actually really huge. This is something that they will have to live with for the rest of their lives, trying to adapt and trying to get themselves used to this new way of living. So I think that amount of effort being put in is certainly huge.
Absolutely. Really appreciate your insight into this topic, Dr. Dennis Hay there. He is a spine surgery expert at Alexandra Hospital and also NUH. Thank you very much.